Welcome to the Freedom and Prosperity Podcast with your host, Desi Arnaz. Join us as we explore the journeys of top achievers who share strategies and stories about their success and living life on their own terms. Get ready to be inspired.
Well, hello, guys, and welcome back. Welcome to the Freedom and Prosperity Podcast. I am Desi Arnaz, your host, and I am looking forward to sharing another exciting episode today with you guys. Today, I have a very special guest that I'm really excited to introduce you to. He's doing something that's different than you probably have ever even heard of. But here on the Freedom and Prosperity Podcast, we're not just about what we're doing in work, we're also talking about life. So you guys strap in because we're going to be talking about, of course, work, wisdom, wealth, and freedom here on the Freedom and Prosperity Podcast. My guest today is Scott Mader. Scott Mader is the CEO and founder of AseptiScope. AseptiScope, that's an interesting name. I like that. Hi, Scott, and welcome.
Desi, thanks for having me.
It's my pleasure. I'm so glad that you're here.
It's my pleasure. It's great to spend some time with you, and congratulations on Freedom and Prosperity.
Thank you very, very much. I'm looking forward to our interview today and some of the pearls of wisdom that I'm sure you're going to drop for our listeners and viewers. So this is good. So Scott, you're here in San Diego with where I am, right? San Diego, California.
Indeed, I am.
Yeah. Have you been here all your life, or how'd you wind up here?
Well, I am a transplant, like so many folks that now call San Diego home. It took me a while to get here. I'm from Canada originally, and in the Midwest most of my youth, and then came down to from Toronto, Canada, to Ohio State University to go to school, play hockey, and then started my professional life on the East Coast. Didn't come out here until about 20 years ago, and it was a wonderful thing, and I've fallen in love with it.
Yeah, we have, in my opinion, our motto here in San Diego is America's finest city.
Yeah.
And I really believe that's true. What do you think?
I'll tell you what, when you think about the quality of life here, the weather, the climate, the topography, and I think possibly as a result of that beacon, the people that call this place home, I think are some of the most wonderful people I've met.
Yeah. That's what I shared with someone yesterday that lives in Georgia. She says, Desi, have you considered leaving San Diego? I said, you know what? While I love everything about this, what I love most are the people. This is a wonderful city, and the people are just really, really great. So
it's absolutely true. And sometimes I wonder, well, so I'm a Midwesterner. I was a nice person in the Midwest. I'm a nice person here, but there is something about the quality of living in San Diego that I think possibly lightens your load and makes you a happier person. I've lived in wet places, I've lived in cold places, I've lived in very hot places. San Diego is temperate. You really only need one closet, one season of clothing. You can go anywhere in your sandals here. It's not a formal place. It's a beautiful place. It's got great food. It's got just beautiful places to walk and hike. And I think I'm a happier person here.
Yeah. And that's a part of the prosperity. I talk about prosperity, not just financially, but, you're living you have a prosperous attitude, prosperous relationships. It's all part of what I seek to share with others. I'd like to say it this way, even though it sounds kind of cliche. I believe you can really have it all if you just play your cards right. And I know that sounds kind of arrogant, but you can.
No, it's true. I think you get out of things what you put into them, and I really believe that is true. That's another cliche, but sometimes I think cliches evolve for a reason. There's a truism to them.
Mm-hmm. Yeah, there's an element of truth certainly woven right inside those words.
That's right.
So you said you started in Canada and then you wound up on the East Coast and then out here.
Yeah, Nova Scotia, Canada is where our family is from. Mm-hmm. And our family relocated to Ohio when my father decided to practice medicine down here. Mm-hmm. And so I was in Ohio for my childhood, went back up to Canada to play hockey in high school, came back down to college in the States. So I've moved back and forth. In fact, we're all dual citizens of the U.S. and Canada. And
Sure.
so my work on the East Coast was driven by my professional career and pharmaceuticals. But coming out here was serendipitous. I went through a painful, we all have different roads in our lives. I went through a divorce. It was not an expected divorce. It was not, a wonderful, wonderful wife. We
Mhm.
didn't have acrimony, but we ended up in a circumstance like that. And when you do that, for me, I wanted some space. So I came out to San Diego really thinking I was going to be out here for just a few years. And lo and behold, 20 years
Yeah.
later, I can say, fell in love with it. So sometimes good things come of difficult challenges.
Well, that's a life lesson right there, right? I mean, because you could have taken a whole different attitude from what you went through as a result of the divorce, but you didn't.
Philosophically, I think it's important when you face great challenges. Philosophically, you can do a lot of things. You can become a victim. You can get angry. You really have to look for opportunity. And the truth of the matter is, honestly, in the trajectory of my life, some of the greatest challenges have turned into the best opportunities for me.
Wow. Wow. Well, now that's a pearl of wisdom right there that people should really grasp, especially some of you younger folks that are watching this, because right now there seems to me in the world, not just in America, there seems to be this whole victim mentality that's kind of floating
Yep.
around.
Yes,
Everybody's a victim. Oh my gosh. But boy, that'll hold you back.
it
And
can. It can hold you back. And I think philosophically, it's in your control to either allow it to hold you back or to move through it. When I was a
yeah.
child, I was not doing well in school. My older brother and sister were these perfect students. Turned out I had a visual acuity problem, later called dyslexia.
Oh.
And my parents had me doing exercises in our basement. They put a little desk down there. For years, I was doing these visual tests with pegboards and trying to reproduce geometrical shapes with rubber bands, and
Hmm.
it resolved my problem. Now that could have stopped me, and my parents would not allow that. I've embraced what they taught me in that point in time, and it has served me well. Used
Wow.
to have to dig in and deal with it. And as a result of that extra work, that's no longer a problem at all. I might be a little bit more of a deliberate reader than most, but
Mhm.
sometimes that's good. My retention is high.
Yeah. Oh, that's good. Boy, oh
Yep.
boy. It's nice when you work through those types of things because it gives you a bunch of confidence. Even as a young person, you get a bunch of confidence, a burst of confidence that you wouldn't have.
Well,
You
you're right. I mean, think about that. A child with a visual perception problem and his older siblings are these wonderful students, and that is actually very
Oh my
discouraging
God.
and can be something that really taunts you. And instead, my parents lifted me out of that, and that's exactly right. I became a much more confident person, realizing that nothing really needs to hold you back.
Yeah. Yeah. And that you're not the problem was the problem. And so you just
It's a
resolve the
challenge to
problem.
overcome. It is a
Yeah.
challenge to overcome.
Yeah, it really is. And my mom kind of taught me that as well too. My dad wasn't around too much, but my mom taught me that I could, I know it's cliche, but she says you can do anything. You can be anybody, you can do anything. Don't let anybody tell you that you can't. And when I was younger, I was like, yeah, sure. But I'm pretty much a believer now that within reason, I mean, I still can't slam dunk a basketball.
I'm
So I'm just not,
with you.
I don't think that's going to happen. Okay. But I got what she was trying to say to me, that I don't need to let things, I guess I could slam dunk a basketball if I put myself a little trampoline in front of it. I still
See, you have
accomplish
to build yourself a slam dunk machine.
Yeah. Yeah, there you go. So that's the point, I think, right? You look at the issue, you look at the problem, and you say, what can I do to resolve this or to at least minimize it? I
Mhm.
hadn't heard of this whole rubber band thing that you're talking about and that it helps with the dyslexia. That's
Well,
it.
this was an ophthalmology expert. At the time, dyslexia was not really a DSM diagnostic standard. It was called a visual perception problem, and this guy was ahead of his time. And I could actually see the results of what he was doing. He was basically just retraining my brain and my eyes to work together.
Wow. Okay, well, that's something for people to think about, And so that
Absolutely.
kind of, you said your dad was in the medical profession, so that led you into the medical profession. Is that how you wound up with a septoscope?
Well,
Started?
yeah, indirectly it is, as a matter of fact. My mother was a nurse, my dad was a doctor. This oftentimes happens, right? You find yourself going down the roads that you are exposed to or programmed in as a child. And I decided medical school was not for me at the time. Managed care was coming in. It was a different time than when my father was trained as a physician.
Hmm.
And I also was tortured by the idea of the life and death challenges that are seen every day for healthcare people. Instead, I took it to industry and started looking at problems, gaps in healthcare. I have developed and worked on introducing new technologies such as pharmaceutical products for how we treat type 2 diabetes or how we treat heart failure. I've looked at and started cardiovascular biomarkers so that we can analyze blood and see exactly what they tell us about somebody's condition or their potential condition down the road. And a stethoscope was born out of that thinking. We identified a gap, something that was, and this was before COVID, but just a few years before COVID.
Hmm.
We saw this gap in how infection control was managed through in the US. And over 100,000 US patients every year die from infections they received while being treated and being cared for in hospitals.
Wow.
And so this is something that needs
100,000.
to change,
Yeah.
something that needs to change. So we identified the most potent vector in the world, other than after the hands. The fingertips of the hands are the most, and we have incredibly intense hand hygiene protocols. But the stethoscope, which touches 5 billion Americans a year, is carrying the exact same bugs and pathogens, but no hospitals have protocols, policies, and procedures for cleaning stethoscopes between patients. And we sought to change that, and that is changing as we speak.
Really?
Hmm.
Huh. I never thought about it because it doesn't go in my mouth. I don't think so much about it. You know what I mean?
Yeah, what's interesting about stethoscopes is that's part of the problem. It's perceived that, if you're touching the skin, well, if you're in an ICU and you have a central line in you, you have an opening in your skin. If you're in a post-surgical situation, you have a cut in your skin. If you're a cancer patient, you're being treated for cancer, your immune system is compromised because immune suppression is how we treat cancer.
Hmm.
If you're an elderly person or a neonate, your
Hmm.
immune system is compromised. So a lot of patients are at risk for this, and stethoscopes become very virulent problems for these people. And the truth of the matter is, you and I may be healthy, but we also deserve clean care.
Sure. Sure. And so basically, a septoscope's role is to help physicians retrain their thinking on cleanliness of that instrument.
Yeah, that's the first one that we've launched. We identified this problem.
Hmm.
And so the problem is really that in healthcare, we already know how to protect people. It's called aseptic technique. Have you ever seen a surgeon get ready for an operating theater that they get dressed by two other people? They
Yes.
don't touch anything. They
Yes.
back into the surgical theater. This is aseptic technique, but it takes a lot. It's a lot of work. It's training, and you can't do it everywhere in healthcare. So we
Yeah.
decided to automate aseptic technique to protect patients from specific vectors. And the stethoscope is the very first one. So that's what our technology is. It only takes a second. It is 100% effective at protecting patients, shielding them from any bugs that might be on that stethoscope. And we're doing it for other technology, other problems too in healthcare.
That's excellent. Wow. So you're going to be saving a bunch of lives.
That's really somebody on a podcast not long ago asked me if it was about the money. And the truth of the matter is, my co-founders and I, sat down and talked. And these are people that are clinical innovators as well, and doctors who treat patients. And we decided that this was something we could do that would save lives. That there's a major gap here, and it's an enormous gap that is costing lives and costing healthcare every single day as well. And so
Mhm.
we went down that road. Now, if you do things properly, profit motive is not a terrible thing.
Right.
It's okay, and that's what free market capital society. Why free market societies tend to be the innovators in the world. We are, and we still are. doing that routinely, and it's because you do something well and you change society in a way that, in this case, saves lives. It's okay to be rewarded for that.
Well, I'm glad you brought that up because, part of our name is prosperity, right? And that is
Right.
financial prosperity is a part of what we talk about. And so many people feel a sense of guilt around the thought of being prosperous. They associate prosperity with taking from someone else. You are prosperous because you're prosperous, there's less for me. That kind of thinking. It's just
Right.
weird, kind of weird.
It is that is the zero sum gain. Like if one person gets rich, somebody must be not getting rich, which of
Yeah.
course is not at all the way it works. In fact, it works just the opposite. And why I'm out here in California is a great example of that. Probably the same, because I know you're a Midwesterner by
Hmm.
origin, so you may have a similar story. But when we come out to start a startup, one of the things that really enchanted me about the startup culture, which is proliferates out here in San Diego and in California, when we start a company and we start hiring people that are like-minded, that are wanting to roll up their sleeves and really solve a major problem, they become owners in our company. They're not just getting a salary. They have equity in our organization. If we do well, they all do well. And that's really what we want. And it,
Yeah.
it really produces a couple of things. It produces prosperity for those who are part of this success, but it also really gets people focused on solving a problem together as a team. And you all band together and it becomes part of the mission. So it'd be nice if everybody was Mother Teresa and just wanted to help people without any, but sometimes you need that innovation to incentivize you to have a more comfortable life, and there's nothing wrong with that at all. And all of
Yeah.
our employees are along for the ride.
I love that. I love that. So you're an employee-owned company in essence.
That's right.
Yeah, that's fantastic. And I think it's brilliant too, by the way. It's a brilliant strategy. I mentioned this book on several occasions. There's a book called Who, Not How, written by a gentleman named Dan Sullivan, and he talks in that book about finding the right people, putting them in the right position, and oftentimes when I talk about, because I have another company with my son-in-law, and
Yeah.
we train people, right, on investing. And oftentimes I'll tell these people, you need to bring in some people to help you rather than trying to do everything on your own. And the
Hmm.
pushback I always get is, well, I can't afford to hire anybody. And they don't get what you just said, right? When you could, if you bring people in, if they see your vision and they enjoy what it is you're asking them to do, if that's where their gift is in that area, it's not always about how much money can you pay me today,
Right.
right? It's not. And so, unfortunately for me, I didn't figure that out till I was already over 65 years old. I wish I had figured it out when I was young like you, where I could say, okay, I could bring in people. I was just trying to do everything on my own for decades. And you get so far, but you also pay a big price for that, right? A big price.
Well, time is oftentimes the price, and Desi, the cool thing about the story you just told is, good people never stop learning, and you and I we're still learning things along the way.
Yeah, that is a good lesson for the folks, you guys that are out there listening. Keep learning, guys. Keep learning. There's so much to know. Don't ever feel like you got it all done. So, Scott, as we wrap up our podcast here today, first of all, I want to say thank you for so much for sharing your story with us. I think it's very inspirational. Is there an opportunity for people to reach out to you in your business and what you do? Um, or is
Yes, of course there is. We are actively now commercializing our technology, so we're out there. And as a matter of fact, we are just relocating to a new, bigger facility for our assembly and manufacturing and shipping and distribution. And we are currently AseptiScope is up on Carroll Canyon Road. We will be somewhere in the San Diego area in a new location in August, and we're zoning in on that right now.
Mhm.
But a septoscope is, we have, all you have to do is a couple digits away. You can find us on LinkedIn, Facebook. We have our
There
website.
you go.
And the Discover system, which is our newest product, is one that has its own website. And Discover is DISK, like a disc,
Oh, Okay.
COVER. So it's a disc that covers your stethoscope, and that's the idea of it. So AseptiScope, the Discover system, and I am really thankful to be on the show today, Desi. Thank you.
Is my pleasure. So disc DISK cover COVER, right?
That's right.
Discover, and is that a website too?
It
Discover.
is. It's its own website because we have so much clinical data, so many publications in the literature, and so many now users that are endorsing the technology that it has its own section. And Aseptoscope has its own website as well.
Okay, beautiful. So you guys reach out, and especially those of you in the medical profession, and bring this into your clinics, bring this into your facilities where you guys are being represented, and get Scott and his team in there to talk to the people the powers that be, so that we can start to save more lives. At the end of the day, isn't that why you entered into the healthcare field? Right, right. That's why you're there. So
That's exactly right. And these
yeah.
people are fantastic to work with. So welcome to contact us anytime. Desi, thank you so much.
Yeah, it's my pleasure. And so, you guys, we're going to wrap this up today. Oh, by the way, Scott, I know that we've kind of talked about a bunch of different things, but as far as helping you along in your own life, are there any books that you might recommend that people read to just kind of help them along as they're trying to find their way?
Yeah, well, I can tell you offhand that there's a lot of books that I've read that have been incredibly helpful. Now, they're not necessarily Carnegie kind of
Right, right.
type books, but these are books of overcoming challenges, great challenges. If you ever read any Ernest Hemingway, this was at a different time in the world. And if you think the world is tough today, go read some Ernest Hemingway and find out how these folks were dealing with the challenges in a post-apocalyptic world war and how to make things happen and how to get along.
Wow.
If you go to and look at innovation, you can look at innovation through The Gold Standard, a book by a friend of mine, Cliff Bailey in the United Kingdom, who was a drug designer and really looking at how to solve problems through pharma design. And then, of course, Sun Tzu, The Art of War, is a great one about how to strategically capture your goals.
I love it. Yeah, I know the title kind of throws you off, but with the Art of War, it's like, okay, well, I'm not a general, and so it doesn't really apply to me. But
You are the general of your own destiny, and that's really the symbolism of that.
Yeah, that's fantastic. Well, thank you. Thank you for those recommendations. I'll put those in the show notes too. So thank you once again, Scott. I do appreciate having you here. You guys, thank you all for watching this episode. I hope you guys will share this with your friends and other people around. Feel free to do that. Reach out to my friend Scott here for those of you that feel like there's a fit somewhere in your world. And in the meantime, guys, just remember, you can have it all. You can have freedom. You can have prosperity, wealth, wisdom, all of it's there for you. You just have to take it. So God bless you all, and I'll see you all on the next episode.
Thanks for tuning in to the Freedom and Prosperity Podcast with Desi Arnaz. Want to share your success story with our audience? Head over to freedomandprosperitypodcast.com/guest and apply to be our next guest.